I remember very well we were at the canteen. This girl received a call that her sister had gotten a problem. So when we tried to inquire what had actually happened, we realized that her young sibling had undergone FGM in a community where access to the nearest health facility was about 15 to 20 kilometers away from home. So once they mutilated this girl, she started to bleed. They tried their traditional things to stop the bleeding, but it was severe. So what happened? They rushed the girl to a 20-kilometer away from home facility. And unfortunately, the girl died along the way. Being that this was my girlfriend, the one at school, I had to accompany her definitely to her village for burial. Unfortunately, when we came back, she did not stabilize at school, and eventually she actually dropped out of school, and the rest of the story is history. Now, when I heard actually about the challenge of UNFPA on eliminating FGM in communities, as an innovator and an entrepreneur, it rekindled the anger. It rekindled the fire that kept burning in me. Why would someone have to die just because they could not access health services in their communities? I did not think about FGM as a problem, but I thought about accessibility to social services as a problem. And as a result of that, we actually have designed a digital mobile platform codenamed Her Story. It is a merger between one project of UNFPA Her Club and then another project of UNFPA Her Club 2021. The other project was called Access Mobile, and then the other was called Her Story. So we've merged those two projects to ensure that any victim of FGM, regardless of where they are able to access social services in the time when they need them. At the same time, this digital platform is to ensure that anti-FGM partners like UNFPA are able to access data, because as we've been discussing in these meetings, these guys are using data that is outdated. They do not have access to real-time data. So as they do this, we believe that even governments are able to use this real-time data to make to implement viable solutions or policies that can eradicate or eliminate female genital mutilation. In a nutshell, as we all know, in African government, most of them have criminalized female genital mutilation. But the question is, how many actually of the cutters are arrested and taken to jail? A few of them. And yet actually the practice continues. Once they're driven away from the urban areas, they go right now, female genital mutilation takes place right in the remote areas where the police cannot access the roads, where even if it is these organizations that are promoting empowerment in these communities, it is very hard for them to access these communities. So for us, what we did was to identify people who live in these very communities. They know the cutters, they speak the same language with the cutters, they know where the problem is, even where these practices take place. So we have, we codenamed them the village volunteer agents that we are able to use to give us real-time data, information as far as FGM is concerned. So getting back to your question, for me, it is a matter of personal interest. Many times when it comes to innovation or entrepreneurs, we sometimes innovate out of the prize at the end of the day, because we want to have the money and do part of the project and do and meet our personal gains. But for me, when it comes to FGM, it touches my personal interest, because I lost a girlfriend. I don't know whether she would be my wife today. And my girlfriend also lost her sibling. So you can imagine how many girls, young girls, actually die without anybody knowing in these communities. These girls die without access to these social services. They don't have access to a lawyer. They don't have access to a medical personnel. They don't have access to the police. They are just left there. And that's why even child marriage is on the rise, because these guys do not have a voice. So we wanted to design something that would give a voice to the voiceless girls, at the same time give them a platform where they can access services in real time when they need them. Thank you.
Thank you. How many of us knew actually this was going to be powerful the moment you heard that it gets personal? And it surely did get personal. So Dirug, please tell us, what is it that you guys at Big Family 360 do, and why did you decide to do that?
Okay, thank you once again. Yeah. So in Big Family 360, like I mentioned earlier, we provide integrated social services to vulnerable women and girls using digital technology. So we have this mobile application called Smart RR. It helps people to report gender-based violence cases anonymously from their smartphones, and then they can also use their basic phones to report these cases anonymously. It was actually quite a long journey, in as much as, like I mentioned earlier, when doing this, there's definitely a reason behind doing it, because I have background in IT, so it is easy for me to start looking for a job with Microsoft, Google, and what have you. But then, and that's the aspiration of almost every tech person in Nigeria. But then, this is very close to my heart, which I think 2 years ago I invited someone very dear to me for one of our workshops. And then after the workshop, she pulled me by the side and she said, "Did you know that I am a survivor, but I never knew, and I've never had the courage to talk about it. But sincerely, I have to thank you for what you're doing. And I would want to tell you that this ends with me in our community." And that person happened to be my blood sister. So, and because I grew from a secretive home where something can be happening and you would not be able to know what is happening there. So, like literally, I don't know that that was really happening right under my nose. So, from there, I think 2 months ago, she called and she was like, "Do you know how many girls I've saved through your initiative, Smart RR?" That over 5 now within this month. So, I was just doing this unconsciously, like, I think maybe because my mom has been drumming it into my head that I have to keep protecting my sisters. And when I started, I was just there to enroll out of school children. Then from there, I joined the gender-based violence subsector, which when I got there, what I was looking for is a particular gap just to help the sector and sign up. And then one of the key issues was underreporting of cases, and I was like, yeah, we can build a solution, because almost everybody is working hard every day just to acquire this device. And I can tell you, in as much as we are in this room now, trying to hear what we are saying, but 70% of us are on our mobile devices. So, yeah. So, it was quite a long journey. So from there, we started building the product. And when we got this opportunity, we said it might not just necessarily be reporting of gender-based violence cases, but it can be at the same time that it can be a virtual one-stop shop for gender-based violence and sexual reproductive health. So where you can access all forms of services related to gender-based violence, which includes FGM. And when adolescent young people are looking for relevant information and services on SRHR, they should be able to access these services anonymously and confidentially as well. So the application, like I mentioned, is called Smart RR. And just to throw back at what she said, my very motivation actually in the first place was to protect my sisters, and then this is now serving people such a way that presently we've had over 1,000 cases reported via the application, and this means that these people have accessed one form of support or the other from service providers. And these service providers, we identify them in local communities where they provide these services for free, including the police, social workers like ourselves, NGOs, as well as lawyers that provide pro bono services to these survivors. So it's been quite an amazing journey with much learning, and we are still learning, and we are hoping that going forward, we would be able to end all form of harmful practices against women and girls, not just now in Nigeria or the northeastern part of Nigeria, but Africa at large. Yeah.
So it was right to call it My Story, My Experience, huh? Okay, so Aisha, you told us that you started as an activist and then you went on into working with the government. So my one question to you would be, why do you think it's necessary to have a collaborative work in between these CSOs, NGOs, the government and individual activists in putting up a fight against these harmful practices?
Thank you for the question. Taking you back, as I said earlier, I started the FGM campaign in 2017 when I gave birth to my first kid. I remember walking to the hospital and I mean, full of pain. The labor was very intense. So immediately I went to the labor ward. The doctors, like, you know how when you get into the labor ward, they check how far you've dilated. So yeah, I remember I was at 6 centimeters, and I think 10 is the maximum where you now ready to deliver. And the doctors were like, this is an emergency. And I remember I was in pain and I had, this is an emergency. One of the doctors shouted, this is an emergency. Prepare the theater. So I was like, what is happening? And I remember my family running around and everybody was so scared. And the doctor said, when I got into the labor ward, into the theater, I remember the doctor telling me, let's just do this. And then I'm going to explain it later when you and the baby are safe. So it happened. I underwent a cesarean delivery and it wasn't easy. So I went into postpartum depression. And immediately after 3 weeks, I started a WhatsApp group and I joined some of my friends and my close family members. And I just reached out to them and tried to tell them of my experience during birth, because I remember I was in labor for like almost close to 2 days. And after going through that pain, now you have to go to theater again and go through much more pain. So when I talked about it, I realized a lot of women and girls were suffering in silence. So what I did, I have a very supportive partner. So when I told him, I feel there's a need for me to come out and speak about my experience. And I remember the doctor 2 weeks later when I went back for my clinic, the doctor told me, from a lot of women from your community are suffering in silence. And the main reason or the main answer he gave me was, this is due to female genital mutilation, because my body was not in a position to open up. Because, when you're cut, your body forms scars and it is not easy for the scars to stretch and open. So when I shared what I was feeling with my partner, he told me, I think there's need for you to come out and share this with public. This could help other women and girls in our community. So I thought of starting an organization, and before registering, I was like reaching out to my close family, close friends, having these casual conversations around FGM. Then I started a Twitter page and, started getting opinions from people of how they feel about FGM. And that is when I realized millions of women and girls are suffering in silence. So I went ahead, I registered a community-based organization in 2018. Then I named it Every Girl's Dream. Actually, my husband is the one who helped me name the organization, because together we believed it was the dream of every girl and every woman to not undergo female genital mutilation. So when I started the organization, looking back, I remember literally I was the only young person in my county who was talking about FGM, because for the longest time ever, it's been a taboo subject to speak about. So when I remember my first radio interview, I have a background in communication. So I reached out to a local community radio station and I told them, I need a chance. I need time to come to your radio and talk to my community and tell them of the experiences that I had. So when I went to the radio station, I realized even more women were suffering in silence. So when I did the campaign, people were not ready to join me. Of course, there were a few women before me who were doing this, but it's like they were doing it in silence. So as a young person, you know how we are, social media. So I started recording videos, sharing my experiences on WhatsApp platforms, sharing it on Twitter, on Facebook. So that is when I realized really there is a need for me to come out and share this with the public. So back in I remember in 2019 now, I started recruiting even more young people and more women. So I remember they nicknamed me Aisha FGM back in my home county. So everybody was referring me to that lady who advocates for against FGM. So I felt so proud. And I mean, because to be identified with such a sensitive issue like FGM and the community knowing you for advocating against a practice that is one of the highest form of violence against women and girls. So in 2019 now I started movement started across even the country. So I started looking for platforms. I will go to meetings. I will come to such forums. I will reach out to anyone who was talking about FGM. I will connect with people on Twitter, on Facebook, on WhatsApp. So I remember one day, it was in 2018 when we had the first Pan-African Youth Conference on FGM in Kenya. So that's when I remember during the conference, I literally wrote a poem telling my own story, and I will read it to people when we had breakout sessions, and everybody was like, I think you have to do this full time. You have to reach out to the community even more. So it went on and on and on, and I recruited a lot of young people. I recruited a lot of women, a lot of young men. So I engaged the elders, I engaged women, I engaged government. So I remember in 2020 now, again, I was pregnant for the second time, very heavily pregnant when we had the first ever youth caravan in Kenya, and we had the UNFPA support, the caravan. So when all the young people from across Kenya, 22 hotspots counties that were practicing FGM came to my county, Isiolo, they were really inspired, because I remember I was due 2 weeks to my date of birth. My due date to give birth. And I remember one of the UNFPA staffs reaching out and telling me, this is enough, go and rest. And I remember going all the way to Samburu. And I said, yes, now I feel like I've done something. And a lot of young people now, registered organizations, registered youth groups, community-based organizations. I recruited young men, and we were in Tanzania just the other day, and I was with one of the young men that I recruited, and he almost cried when he came to me and he was like, you know what? I'm so proud of you, just out of the blues. And I felt, you see, that parent who raises a child and the child has achieved a lot. And it's been a journey and it's been a lot. So yes, as it was earlier mentioned, I was recognized and by the president, the former president, for the advocacy work that I did. And that encouraged me even more and more. So as a survivor of FGM, I think the journey was really tough. So on the way, I got mental breakdowns, and for an year, I think for the whole of 2022, I wasn't really active and I had to take a break. I took like an year because, you know, when you do these things, you get burnout. And when you get burnout, you can even die. And when you die, people still live and forget about you. So, and that is an issue that people don't really embrace as survivors or as activists or as, you know, people who are championing for different issues. So I said, I need to take a break. Because you see, when you do these things, sometimes the community you advocate for, the community you are almost dying for doesn't appreciate the work you do. So I said, I need to take a break. I took a break, a very long one. And I must say that it was not easy, and it's still not easy. But the only thing I know is I have recruited people and people are now working on my behalf, if I may put it like that. So
Okay, Aisha,
yeah.
I think I'll have to cut you short
No.
for now. We'll continue where I've stopped you. And right about this moment, joining us here in this conversation late is Mark Marangu, who is a founder and lead of Total Register. Mark is a dedicated social impact innovator with a deep passion for driving positive change. With a background in development, communication, and computer science, Mark has extensive experience in the field of gender, community development, and innovation, focusing on critical issues such as female genital mutilation, gender-based violence, and climate change. Mark, I have to cut your bio short and have to call you up here. You're welcome. So Mark, as you're joining us, please kindly, because you're late and people have been waiting for you, in just 1.5 minutes, tell us all together, what is it that you do and what drove the force that for you as a man, we know there's no very possible way that physically you are affected by FGM. So you please kindly tell us, what is it that you do and why did you decide to do it?
Okay, thank you, Glory, and my apologies to everyone in the room for being late. Today is a holiday in Kenya, so there's a lot of movement, and there was a terrible accident, so we had to go around the county, but I finally made it. So as you've heard, my name is Mark Marango. I am the founder and lead of Total Register, a child-centered digital innovation that is designed towards protecting girls and preventing FGM. So, and it's a privilege to actually join the panel with such a story-rich panel, I would say. I have interacted with most of you. It's a pleasure to meet you, Joseph. And I would say that the journey has actually not been easy, as you've heard from everyone. So I come from a community called the Tharaka people. We live in Tharaka Nithi County. So it's one of the 22 hotspot counties in Kenya. And FGM is a deeply rooted social and gender norm in our county. So I actually, growing up, it wasn't really an issue because it was one of those things that just happened, you know? So and there was literally no advocacy at that time. There was very little non-profit engagement and humanitarian engagement, especially on harmful practices. And at that time, we remember the trends were a bit different. Right now, we can appreciate the effort UNFPA is putting, even in making sure that they penetrate such heavily cultured societies. So at that time, it was a bit difficult, and FGM was not really a thing you would know about. I know most of you understand what I'm saying when I'm saying this. So when growing up, we learned subjects such as science. We learn about the human body. We interacting with girls in the class, and some very funny, the very funny questions that cheeky boys raise in class. And I hope to one day meet that boy who raised that issue. And it was actually a vulgar joke, but it's the joke that made the whole class aware about FGM. And that was the beginning of impacting us as a whole generation. Because if it wasn't for that funny joke, I would not know that the women in my community have undergone FGM. So that evening I went back home and I was able to get my mom and my aunt and ask them, there's something funny I had in class. So the same cultural rite that we are supposed to go to as boys when we finish primary school, is it the same ones that you get? And my mother and my aunts, they told me, yes, it's the same one. And I asked myself, how? Because it wasn't making any sense at that point. From what we've learned, we have very different bodies, and the purpose of the circumcision that happens to the male children, especially in our communities, is very different from the one that we were able to be explained by our teacher about FGM. So that was the beginning of my curiosity on this thing that affected our mothers, our aunts, our grandmothers. And that was the beginning for me. So during high school, I was able to volunteer in a few organizations that were working towards prevention of harmful practices and advocacy. And I carried on the spirit also in university, where I was able to intern at a community-based organization called Enlightened Generation International, which I'm proud to say I'm currently the acting assistant director. And it's an organization that was formed by Honorable Aisha's friend during the very same time you've had the crazy stories about the caravan. So it was the same organization that has been able to hold my hand and give me a platform to practice innovation, to also be able to attend such forums and understand what other people are doing. And a little bit about Toto Register. Toto Register is basically, it was inspired by the need to integrate real-time data analysis in the fight against FGM. So we all understand that the trends are changing, and they have changed so dynamically. FGM doesn't happen the same way it used to happen 10 years ago, 20 years ago. It's now factored into our systems, our school system, our school calendar. So we have to actually innovate beyond the methods that we've been using, advocacy and all this. So I remember I mentioned this yesterday during my presentation. I remember there's a meeting that we went to, and a document was presented. It was a review of the effectiveness of interventions geared towards prevention of FGM. So this review was basically saying that advocacy, we've been doing it for long, but it doesn't seem to be working, because as much as it seems to affect attitude change, we still don't have behavior change. It doesn't hold people accountable. Awareness and education in schools, it takes a long time to get the fruits of this. So we had to think deeper. And this called for us to hold dialogues even with community members and all child duty bearers. And at this time, I was fortunate enough to be working in a community-based organization that was properly linked in the county and nationally as well in the fight against FGM. So we were able to hear from many stakeholders about the pressing needs and how we can actually improve the fight against FGM. So Toto Register basically empowers teachers to take attendance using a mobile application in schools, and the alerts, which is transmitted to a back end where we're able to generate alert, leveraging on big technology such as the machine learning, what you hear, the AI algorithms. So we are using them to look at the attendance data across age proximity, geographic proximity, the age clusters, and all these other relatable variables that can be measured against other factors to be able to give us a clearer picture of the FGM landscape and how we can prevent it, especially in the high-risk areas. I think I will pause there.
Yeah. Okay, so I'll pose this question to the two of you that are in tech. We know that we are moving fast with the pace of technology, but we are having those communities that are marginalized. They have not as quite as developed as other areas are. So do you think Africa in general, because if we say these communities, it's rather like 3/4 of some of the countries are not impacted fully with technology. So do you think Africa is ready to really leverage with the development of technology and innovation in putting an end to these harmful practices? So either one of you can start.
Since I have the mic, I will start. I would like to say that as far as Africa is concerned and the use of technology, we are talking about female genital mutilation. This practice actually nowadays takes place in flank communities where accessibility or the infrastructure development is very, very poor. We cannot refute the fact that advancement of technology is also penetrating through these small flank communities where accessibility before was a problem. However, may I believe that we should take it slow but surely, because when we start to design mobile apps for people who do not even have money to buy internet data, people who do not even have access to smartphones, then we are not being realistic at times. Rather, for us, actually, as I said, when we decided to design the Her Story project, the initial idea was to design a mobile app that would link survivors, victims to service providers. But we got back and were like, hey, how can we design a digital platform for people who are actually the primary beneficiaries, and yet they do not even have access to the gadgets through which they can have access to the service? And so we resorted to, there is a saying that goes that you set a thief to catch a thief. I don't know whether you guys are familiar with such a statement. So for us, what we did was to identify people within these communities. Actually, right now we are working with over 1,000 youth from the Global Consortium Against FGM. We have the youth volunteers in these communities who are working currently as our rapporteurs to ensure that they verify the information that we get, they are accessible to the end beneficiaries. So what we did was to identify the people with the youth, especially within these particular communities where FGM takes place. These guys have at least access to a phone. It could be a smartphone. There are some who have access to a smartphone, like in the entire community where FGM takes place. It could be that only 10, especially the young people, because they have to social network, blah, blah. So they have access to smartphone, but even they don't have money to buy internet data. So what we do, we give them a small incentive for data accessibility, and then they use their smartphones to generate information and be able to be accessible to the end beneficiaries in order for us to get data as far as FGM is concerned. So with this, actually, the program has been successful. Currently, we are going further to engage NGOs because we realize that concentrating on only digital in terms of mobile apps, because nowadays, most especially when we talk about digital, we talk about web apps, we talk about chatbots, we talk about mobile apps. We forget that the end beneficiary does not have access to all these. And that's why most digital innovations in terms of mobile apps, without sustainability in terms of grants, they fail. Because you'll design a mobile app, UNFPA gave you 10K, you don't have, it is kind of charity work. You don't have someone who is going to pay for the service that you're providing in the mobile app. And so you need a little bit of more grants to be able to sustain the app that you're doing. But for us, we are now getting to churches to donate clothes that we can donate to these people. We are getting to companies to donate scholastic materials that we can donate to the people in the communities. We are getting to different companies to be able to bring something. We've been able to collect pads, because we realized that when we were doing our validation study in these communities, a man sits and his things are out and he doesn't care. It looks like to them it is actually very normal. We talk to a woman, sorry to say this, but a woman does not understand what a pad is. And these are the people that we are saying we are solving or innovating for digitally. So for us, we realize that we need, first of all, to tackle the current needs of these people as an entry point to end female genital mutilation. As we are giving them the pads, as we are giving them the scholastic materials, as we are donating clothes, we mobilize the church elder, the community elders, the women, the youth, the men, and talk to them about FGM. We introduce our village volunteers to them so that in case one has a problem, they are able to reach out. We have also introduced what we call a USSD, where these people do not have to have a smartphone or internet data to reach to us. They just get to the USSD and they're able to call for help. We also have what we call, right now we want to scale it to a 5-channel toll-free line, but right now we are using one, where someone is able to call and they are not charged to be able to report cases of FGM or even call for help or rescue. Once they do that, we connect all these calls to the nearest police station or to the nearest village volunteer agent who is able to follow up the story. But when you get also to our platform, actually, a victim or even a mere community member is able to use our platform to record a video anonymously, but you don't have to directly do like what you guys are doing to record a case of FGM. By you holding your phone and directing it to where the activity is taking place, we get a notification that something is happening, and we are able to retrieve that video or simply voice call in terms of audio recording, or simply someone reporting FGM using a photo. So all these things for me are, I believe that as far as technology advancement is taking place in Africa, we need to go slow. Yes, advance the agenda of technology reaching these flank communities, but having it in mind that if we want to actually eradicate the harmful practices that we are talking about, we need to go with what is available to the local community. Use what they have in order to eliminate the practices.
Thank you so much, Joseph. Dirug, if you can just take a minute or two.
Yeah, thank you so much. So for me personally, when it comes to technology, whether Africa is ready or not, first of all, where I'm coming from, Nigeria, our reality might be a little bit quite different from other African countries, possibly. First of all, looking at our population of over 200 million, I think 220 million presently. So, and I do say this, that just as COVID came, I think Nigerians are the most stubborn in Africa. Sorry to say that. We were saying that it's actually a white man problem. It will not come to Nigeria. Nothing will happen. And then until we woke up one morning and then we were all locked at home and we could not do anything about it. And that's how fast technology is coming upon us, as far as technology is concerned. Secondly, in Ghana, I think the total number of mobile phones in Ghana is 2 times the number of population in Ghana. That means, in as much if you read the China Africa report, you discover that at least per household, one person have smartphone, and then the remaining, they either basic phones or at least they know someone who have access to smartphone. So these are realities. I could remember last year we piloted our innovation in an IDP camp because one of our donors said that we have to understand if vulnerable people, displaced people can access services through this. And when we got to the IDP camps with our mindset that these people don't have access to such devices, and then we got to discover that even adolescent girls in the IDP camp have these devices as well. So these are realities in the space that I would still say that to a larger extent, Africa is gearing towards like using, it's not just gearing, but Africa is ready to take advantage of technology. And I'm just permit my own limitation of coming from one region of the continent, which is Nigeria, and you know that technology is really quite a bit advanced there, because the most remote areas now you get 3 to 4G network, which can allow you to access internet. And then I think in Africa we are still the highest in acquiring the Starlink network, where we don't need telecommunications companies to provide us with internet services. So even in remote areas, you see people are acquiring these devices just to access internet. And just to cap it all, I could remember we were having a meeting with some strategic partners, and then they asked one question, that how can you use mobile applications or USSD code to provide services? Because these are people in villages that don't have access to these devices. And the regional coordinator asked, do these people access banking services using same USSD code and smartphones? They said yes. Then why are you saying that mobile applications and USSD codes cannot work for them? You understand? So they use these services actually, and it's available there. So I think the effort now should be that Africa as a continent, we should now strengthen our response mechanism, train more of the police officers to know how to manage such cases. That's one of the gaps that we've identified. Train more of NGO workers to know how to respond to survivors.
Okay. And that is the beauty of my experience, my story, because we get to hear exactly people and what people have been doing on the ground. From Uganda, he has responded that technology is still low, but you have seen from Nigeria, they are quite advanced. So what works for them is not what really is happening in Nigeria. So our time is quite rushing. As I'm asking Aisha one question, I want you all in the floor, if we can have just 2-3 questions to the panel, if there are any. So if there is any question, prepare your question. I'm coming back to that in the next minute. And Aisha, just in 1 minute, I have 2 questions that I want you to answer them precisely in 1 minute. The first question is going to be a bit personal, and then the second question, you have to just be precise. So the first question is, did you, before going to the hospital to give birth, know that you're mutilated? And the second question will be, given that you have worked with youth, and right now we are seeing the large percent of the activists, of the innovators, and the people that are championing against these harmful practices are youth, do you think we are able to end these harmful practices by 2030? Or we just have to follow what AU told us yesterday, that we are following their Agenda 2063? So please, short and precise.
Yes, I knew, because I was mutilated at the age of 7, along with my cousin and friend. I knew, and I'm the one who bought my own razor blade to be cut. Actually, I was so excited. And the night prior, I wouldn't even sleep. We were just telling stories the whole night of how tomorrow will be our big day. You know, we were excited because when you are cut, it's like there is like a ceremony, you get gifts.
Becoming a big sister.
Yes, I know. So I was excited. Every time a girl will be cut from my class or our school, I will be like, cry. I'll cry to my parents and ask them, when is my day coming? So I knew it very well, and I was excited. And till I went to give birth, I was a pro FGM. Yeah, till I went to give birth. And I knew FGM was a good thing throughout my life. So yes, I knew, and I knew it very well. And the other question you asked on, do I think the young people can end FGM by 2030? Yes, I think, because when you look at this space, like even right now, majority of us are young people, and majority of the people driving this agenda of ending FGM, especially, I don't know about the other African countries, but for my country, it's the young people who are driving this change, and they are the ones who are out showing the will to make sure that every girl is safe and doesn't undergo FGM. When you go on Twitter, platforms like Twitter and the social media platforms, you will find the young people making positive noises and, you know, trying to hold the government accountable. For example, in my county, I think being appointed as the youngest advisor to our governor isn't something, I don't feel like he did me a favor by giving me that position. That's what I always tell people. It's something I worked for. And there's a question I really didn't answer you very clearly about the collaboration between activists and the government. I think we cannot do a lot without the support of the government. Even today's, even the convention that we've had for the past 3 days, if the government of Kenya said we're not going to host this convention, I don't think it will be possible. So it's critical to have the government. That is why in 2022, when we had the general elections, I almost vied, but I did not. But I made sure I get into these political spaces to get that political power to influence. I really campaigned for the team that is currently in power, and I was in the first, the number 1 in the list of nominations for the member of county assembly for the Jubilee Party. And I've not given up yet. Unfortunately, none of the members of county assembly were elected. So I didn't lose, they lost. So it's important to be in these spaces. As young people, we are tired of with the notion of always saying, we are the leaders of tomorrow, we are the leaders of tomorrow. We are the leaders of today, and today is now. If it's not now, it's never. So yes.
Yeah, so in simple, it's now or never. Okay, so here's how I have to get biased. Okay, so I see many, okay, someone is using a lot of efforts to raise her hand. Can we have that as the first question? I here want to favor some people, and these people are not even raising hand. So we'll have the younger lady over there asking her question. And because I'm seeing only 2 gents raising their hand, oh, there's 3. So we'll have the third question here and the fourth at the corner. Then if and only if you want to sacrifice your breakfast, we'll have another set of questions. Yeah.
Good morning. Thank you to our panelists. It has been a wonderful session. My question is to Aisha. I didn't know you were such a powerful tool. When I came in the morning, we were seated together up there for the session. But what I noticed in her, I saw some socialness in her. My question to you is, okay, my name is Phoebe from Kisumu. I'm the director of an organization called Ball Like This Kenya. Aisha, it's like the tool you are using in communicating to the youth or the people on the ground is too powerful. If you could share this tool, because it's like you are communicating to so many people and it is reaching a wider margin. And you remember the first day when we were opening the summit, one of the challenges we saw was people who are in the rural, marginalized areas like Samburu, Kuria, Pokot, how they could use the app even to report such vices like FGMs, early child marriages. And because I can see you are in a communication field, and it's like working to you, how do you use this communication tool to reach a wider margin? Thank you. And you are doing a good work. Continue doing the work you are doing. I think in the next 2 years, I will see you somewhere in our corridors. Thank you. Yes.
Okay, so if you can have the second question first.
Good morning, everyone. My name is Victory Muchoki. I'm working for Plan International Kenya. So my first question will go to the guy with the smart BRR app. I've just downloaded your app and I was trying to kind of report a case, which I was just trying how it can work, but I've just realized it cannot go through in my community. So I was wondering, is it only for Nigeria, or how are you intending to upscale it to other countries, and most importantly to the people in the rural areas? Because I believe that this is workable, even though we say there is no internet. If we have the goodwill from the community, and also with the USSD code, it's definitely going to be possible, since most of us use the USSD code to access banks. We use the USSD code, or we use M-Pesa. I mean, it is innovation, right? So as long as there is goodwill from the government and also from the community, it is very possible. And so if you will also share with us how you intend to upscale that to our country, and most importantly to the community. And the second question goes to Aisha. Thank you so much for the good work that you're doing. But my question is, I try to put myself in your shoes and to really understand how your family got to work through this. Like, how were they supportive? Since you were like, you were already so familiar with FGM, and you had already accepted that FGM is a good thing, meaning your family already supported and were proud of you as their daughter, since you support their cultural practice. So what happened when you were like going against their practice? How did they resonate with you? And the moment you shared your experience about childbirth, how was your family? Did they side with you, or did they see that, no, it's normal? Or you will explain to us how that was. And also my other question was already mentioned, your advocacy strategy is excellent. So if you can share it to other young advocates, how do you do it? Because we would like to embrace it. Thank you so much.
Can you please pass the mic to the gent in the blue?
Bonjour tout le monde. Aujourd'hui, je voudrais m'exprimer en français pour que je puisse bien dire ce que j'ai envie de dire. Et je vais aller lentement afin que la chose puisse être bien comprise. J'ai bien aimé vraiment tout ce qui a été dit ici. Et ma question s'en va vers monsieur. Nous avons plusieurs fois participé à des événements, à des concours où il faut faire des propositions. Et récemment, nous faisons plutôt face aux propositions numériques. Moi, je sais que chez moi, en Guinée, d'accord, même si vous êtes au-dessus de l'avion, il y a des endroits où vous savez que l'Internet ne passe pas du tout. Vous savez que ces endroits-là, des gens n'ont même pas de téléphone. Vous savez que ces endroits-là, ça ne peut pas marcher, ce genre d'application. Pas du tout. Ce sont des choses qui sont limitées. Et donc, je voudrais savoir, est-ce que nous proposons des solutions liées aux applications parce que cela a été demandé par les bailleurs, ou est-ce que nous les proposons parce que nous savons que ça peut impacter la population? Moi, je ne voudrais pas proposer une solution qui concerne les gens de la ville. Je voudrais plutôt proposer des solutions qui vont non seulement les concerner, mais qui vont aussi impacter les gens les plus éloignés de la ville, les gens au-delà des frontières. Et justement, ça rejoint sa question. Est-ce que ces applications peuvent aussi aller au-delà de vos frontières? Sachant que nous avons des applications, mais il y a des problèmes. Et jusqu'à présent, les gens cherchent à savoir comment est-ce qu'il faut répandre cela. Le seul problème, c'est parce qu'il y a une limite aux applications. Alors, pourquoi ne pas lier ces applications à autre chose pour combler encore cela? Pourquoi?
So can we have the last question, and please I'll ask the respondents to be as quick as you can.
All right, thank you so much, Honorable Aisha. That's a very wonderful one, using your story to change narratives of women and girls. So Honorable Aisha, I just wanted to ask, Aisha, how were you able to manage issues around stigmatization and retaliation? Because I know being an advocate, there are issues. So I just want to hear your story on how you're able to manage stigmatization, being a survivor, and retaliation, being someone who wants to change their narratives. And lastly, I see your advocacy wonderful. And I'm thinking, for an effective advocacy, funding is very important. What's your resource mobilization strategy? How are you able to get funding to reach out to the community you have so that we can also learn from it and see whether it's something we can adopt in our country? Thank you so much.
My one will be quite short and precise. Yeah, so thank you so much for downloading the application, and thank you for what you said. Presently, it's available in Nigeria, but accessible across all other African countries. But the reason why you cannot report or see any available service provider in Nairobi here, it's because we've not scaled up to Nairobi, and our scale up plan, it's the very reason why we are here. So we're hoping, beautifully enough, with the right resources, we should be able to at least scale up across 5 African countries by 2024. And then regarding my brother from the Francophone country, just like I mentioned earlier, in as much as we know that there is a gap, that there are certain communities that don't have access to smartphones or access to internet and what have you, we're not just building innovations because donors actually requested, like, or push out a call there. I developed Smart RR with my team. And we did that, I think, for almost 2 years before accessing before accessing donor funding. So the thing is, in terms of scaling up, we're trying our possible best to scale up to other African countries. But for now, we are basically in Nigeria, though we've started having some countries, like the government of the countries actually requesting for Smart RR to be deployed in their country. And it's one of the things, like, we were glad that DRC actually reached out to us, their government, that they want Smart RR to work in their country. So we are hoping that other African government as well would want to have that. But in local communities, like I said earlier, yeah, we cannot deny the reality that there are certain countries in Africa that internet penetration is quite low. Access to smartphones is it's quite low, and of course even the USSD code. So, but then for now, our innovation is serving those that have access to these devices and internet. And with internet penetration, we know definitely one day they would be able to access such services.
Thank you. Aisha, please, nice and quick.
Thank you for the questions. Like the questions that were repeated like 3 times is the advocacy strategy that I use first. We use education as a very critical tool in terms of creating awareness. What we do when we create awareness is we have conversations with women, elders, and the other stakeholders, as I said before. And during this awareness, what we do is when we get into a community first, like when we get into a certain village, we first have the women alone, talk to the women, get their view, get the elders together and the men together and the young people together. Now, when we have the views from all the different community members, we now bring them again under one umbrella and get to hear their opinions when they are together. And what we realized is when women are in the same room with men, the opinions they give when they are alone and when they are with these men or the elders, very different. So we use that as a very critical strategy. And then through awareness, again, especially social media for the young people, which is very important. Storytelling for the survivors of FGM. Like right now, when I come and tell you my story, like how FGM has affected me, and when another person who is not from my community comes and tells you, I mean, from that community that practices FGM, comes and tells you that, you know, FGM is wrong, FGM has this and this effects, I think you will take it more from me who has undergone FGM and has that firsthand experience than the person who is not from that community who has practiced FGM. So we use survivors as a very key people in terms of addressing issues of FGM and giving their own stories. Then we use local media stations, especially radios, to create awareness. We don't want to assume that the assumption that most people have is they say that like people already know about FGM. It's just that they're ignorant. Trust me, some people don't even know the effect that FGM has on that body of a woman or a girl. I remember recently having a conversation in one of the rural parts in my community, and one of a very renowned elder stood up and said, is this really what women and girls go through? Because what we do is we put videos and show them that this is how the clitoris of a woman looks. This is what is being cut. And this is what happens when the clitoris is being cut. I think we need to move from being shy of sharing this information about our genitals. Because the moment we keep on, being shy, things don't change. So, and then policy and allow me to finish, please. Policy and legal frameworks. Like in Kenya, we have the Anti-FGM Act 2011. Most people know that FGM is illegal in Kenya, but does a 50 or 60-year-old woman from Garissa, from Mandera, or from Oldonyiro, or the interior parts of my country or county, from Pokot, the interior parts, do they know what this act says about that person who practices FGM? So we use that as a key, because one thing I know is people are afraid of sorry, Kenyans, we love mixing Swahili and English. People are afraid of they fear the government, basically. So we make sure that they know what the law says about female genital mutilation. Lastly, women economic empowerment. When you look at these communities, most of them are not empowered. Most of the women are not empowered. As community like Samburu that also lives in my county, they do FGM for a girl to get married. Why? So that she brings cows and goats and camels when she's going to get married. So when a community or a woman is empowered, I am 100% sure that we will end female genital mutilation. And the last questions, I don't want to leave questions unanswered. They are around stigma. There is stigma, of course, in everything you do. Like, you don't expect 100% of the people or your community members to support you. I do get backlashes on social media. Even yesterday, someone was telling me, stop talking about FGM when women in Palestine are being killed. So I think we go through a lot of stigma, and it needs someone who is really tough-skinned, who is ready for anything. So when you're in this space, you just do your thing. Okay. The last one about funding, most of the initiatives that we've run as a community has been purely on voluntarily basis. But when you go and do your things, be present on social media. When you do an activity as a young person, tag that relevant organization, tag UNICEF, tag UNFPA, Google which organizations deal with issues of women empowerment and all that. Then through that, we received funding twice. Thank you, UNFPA, for the opportunity you gave us for the funding. And since then, we've been like receiving some small money, not big. Yeah, so I think I have answered again, the last point. It's important to have a mentor. It's very important for someone you look up to. For me, I always love talking about this. I was inspired by a young woman who was the youngest chief administrative secretary or assistant minister, and she held my hand all through. She has very good communication skills. So even when you get into these communities, be sensitive of which community you're visiting. For example, you can't come to my community in mini dresses, or when you're like, you have to be part of that community. So how you look, how you communicate tells a lot about like, are people going to get the message from you? So I think I've exhausted and answered all the questions.
Okay, so I think that requires and calls for a round of applause for the whole session that we have had. Much as I can still see some people wanting to raise hands and talk, my hands are tied. There's another very important session that has to go on in the main hall, and at least 75 of the participants of that session are still in this room. So before I am denied to go back to Tanzania peacefully, I would like to call this session a day. I believe that we have all had their stories, and there's no limited interaction after this. If you see Aisha just across the door, grab her, let her tell you how she exactly did everything she did. Thank you all for being with us this morning. I believe that we are all going to get up and head back to the main hall. Thank you.